Welcome to our comprehensive guide on first aid. In emergencies, knowing how to respond quickly and effectively can save lives. This video will walk you through essential first aid steps, including CPR, so you can feel confident in any situation. We'll cover what first aid is, why it matters, and how you can prepare yourself to help others. Whether you're at home, work, or out in public, these skills are invaluable. Let's start by understanding the basics and setting the stage for the step-by-step instructions that follow. First aid is the immediate care given to someone who is injured or suddenly ill before professional help arrives. It's about stabilizing the person, preventing the condition from worsening, and promoting recovery. First aid can range from treating minor cuts to performing life-saving CPR. Understanding the scope of first aid helps you stay calm and act appropriately when faced with an emergency. Remember, your actions can make a crucial difference in the outcome for the person in need. Before rushing to help, take a moment to assess the scene. Ensure your safety first. Look for hazards like traffic, fire, or electrical wires. Once it's safe, check the person's responsiveness. Gently tap their shoulder and ask if they're okay. This initial assessment helps you determine the severity of the situation and what steps to take next. Staying calm and observant is key to providing effective first aid. If the person is unresponsive or the situation is serious, call emergency services immediately. Provide clear information, your location, what happened, and the person's condition. Stay on the line until help arrives, following any instructions given by the dispatcher. Quick and accurate communication can speed up the arrival of professional help and improve outcomes. Approach the person and gently shake their shoulder. Speak loudly, asking if they are okay. If there's no response, check for breathing by looking at their chest for movement and listening for breath sounds. If the person is not breathing or only gasping, it's time to act quickly. This step is crucial in determining whether CPR or other interventions are needed. If the person is unresponsive and not breathing, open their airway. Tilt their head back gently and lift the chin. This maneuver helps clear the airway and allows you to check for normal breathing. It's a simple but vital step before starting CPR or rescue breaths. Always be gentle to avoid causing further injury, especially if you suspect a neck injury. With the airway open, look, listen, and feel for breathing for no more than 10 seconds. Watch for chest movement, listen for breath sounds, and feel for air on your cheek. If the person is not breathing or only gasping, it's time to begin CPR. If they are breathing normally, place them in the recovery position and monitor until help arrives. If the person is not breathing, start chest compressions immediately. Place the heel of one hand in the center of the chest, place your other hand on top, and interlock your fingers. Push hard and fast, at least 2 inches deep and at a rate of 100-120 compressions per minute. Allow the chest to rise fully between compressions. Effective compressions are critical to keeping blood flowing to vital organs. After 30 compressions, give 2 rescue breaths if you are trained and willing. Pinch the person's nose shut, cover their mouth with yours, and blow until you see the chest rise. Each breath should last about 1 second. If the chest doesn't rise, reposition the head and try again. Continue cycles of 30 compressions and 2 breaths until help arrives or the person recovers. If you are not trained in rescue breaths or are uncomfortable giving them, perform hands-only CPR. Focus on continuous chest compressions at the recommended rate and depth. Hands-only CPR is effective and can still save lives, especially in the first few minutes of cardiac arrest. Keep going until professional help takes over or the person shows signs of recovery. Automated external defibrillator (AED) can greatly increase survival chances in cardiac arrest. Turn on the AED and follow the voice prompts. Attach the pads to the person's bare chest as shown in the diagrams. Stand clear while the AED analyzes the heart rhythm and delivers a shock if needed. Resume CPR immediately after the shock or if no shock is advised. If the person is breathing but unresponsive, place them in the recovery position. Roll them onto their side with their lower arm in front and upper knee bent to support the body. This position keeps the airway open and prevents choking if they vomit. Continue to monitor their breathing and be ready to provide further help if needed. For bleeding, apply firm pressure to the wound with a clean cloth or bandage. Elevate the injured area if possible and maintain pressure until the bleeding stops. If blood soaks through, add more cloth without removing the original. Severe bleeding requires immediate medical attention, so call emergency services if necessary. For minor burns, cool the area under running water for at least 10 minutes. Do not use ice or greasy substances. Cover the burn with a sterile, nonstick dressing. For severe burns, avoid removing clothing stuck to the skin and call emergency services immediately. Burns can be very painful and may lead to shock, so monitor the person closely. If someone is choking and cannot speak or cough, act quickly. Stand behind them and give up to 5 back blows between the shoulder blades. If this doesn't work, perform abdominal thrusts Heimlich maneuver by placing your fist above their navel and pulling inward and upward. Alternate between back blows and thrusts until the object is expelled or help arrives. If you suspect a broken bone, keep the injured area still and supported. Do not try to straighten the limb. Apply a splint if trained and use padding for comfort. Seek medical help as soon as possible. If there's bleeding, control it with pressure but avoid pressing directly on the bone. Immobilization helps prevent further injury. Shock is a life-threatening condition that can occur after severe injury or illness. Signs include pale, cold skin, rapid pulse, and confusion. Lay the person down, elevate their legs if possible, and keep them warm. Do not give them anything to eat or drink. Call emergency services and monitor their breathing until help arrives. For a nosebleed, have the person sit down and lean forward slightly. Pinch the soft part of their nose and hold for 10-15 minutes. Avoid tilting the head back as this can cause blood to flow into the throat. If bleeding persists after 20 minutes or is very heavy, seek medical attention. If someone is having a seizure, move objects away to prevent injury. Do not restrain them or put anything in their mouth. Place them on their side once the seizure ends to keep the airway clear. Stay with them and offer reassurance as they recover. Call emergency services if the seizure lasts longer than 5 minutes or if it's their first seizure. Severe allergic reactions or anaphylaxis can be life-threatening. Signs include swelling, difficulty breathing, and hives. If the person has an epinephrine autoinjector, help them use it immediately. Call emergency services and keep the person lying down. Monitor their breathing and be prepared to start CPR if necessary. If poisoning is suspected, try to identify the substance involved. Do not induce vomiting unless instructed by professionals. Call emergency services or a poison control center for guidance. If the person is unconscious or not breathing, begin CPR and follow emergency instructions. Quick action and accurate information are vital in poisoning cases. During an asthma attack, help the person sit upright and stay calm. Assist them in using their inhaler following their asthma action plan if available. If symptoms do not improve or worsen, call emergency services. Stay with the person and monitor their breathing until professional help arrives. If you suspect someone is having a heart attack, have them sit down and rest. Loosen tight clothing and help them take prescribed medication if available. Call emergency services immediately. If the person becomes unresponsive and stops breathing, begin CPR and use an AED if available. Early action is critical in heart attack situations. Stroke symptoms include sudden weakness, facial drooping, and difficulty speaking. Remember the FAST acronym: face, arms, speech, time. If you notice these signs, call emergency services immediately. Keep the person comfortable and monitor their breathing. Do not give them anything to eat or drink. Quick recognition and response can save lives and reduce long-term effects. If someone is showing signs of hypothermia, shivering, confusion, pale skin, move them to a warm place. Remove wet clothing and wrap them in blankets. Offer warm, non-alcoholic drinks if they are conscious. Avoid direct heat sources like hot water bottles. Seek medical help as soon as possible as hypothermia can be life-threatening. Heat stroke is a medical emergency. Move the person to a cool place and remove excess clothing. Cool them with damp cloths or a fan and offer small sips of water if they are conscious. Call emergency services immediately. Monitor their condition and be ready to provide further first aid if they become unresponsive. If someone faints, lay them flat on their back and elevate their legs. Loosen tight clothing and ensure they have fresh air. Usually the person will regain consciousness quickly. If they do not wake up within a minute, call emergency services, monitor their breathing and be prepared to start CPR if necessary. A well-stocked first aid kit is essential for effective response. Include items like bandages, antiseptic wipes, adhesive tape, scissors, gloves, a CPR mask, and a thermometer. Regularly check your kit to replace used or expired items. Having these supplies on hand ensures you're ready for a variety of emergencies. Remaining calm is one of the most important aspects of first aid. Take deep breaths, focus on the steps you've learned, and act methodically. Panic can make situations worse, so trust your training and instincts. Your calm presence can also reassure the injured person and those around you. Now learn the essential steps of first aid, including how to respond to various emergencies and perform CPR. Remember to always prioritize safety, call for help when needed, and use your first aid kit effectively. Regularly refresh your knowledge and consider taking a certified first aid course for hands-on practice. Being prepared can make all the difference in an emergency. Stay safe and ready to help others when it matters most.